10 surprising habits that may be causing your high blood pressure high. Blood pressure is a common problem that affects millions of people worldwide. But did you know that certain habits can increase your risk of developing this condition? From stress to diet and physical activity, there are many factors that can contribute to high blood pressure. In today's video, we will discuss 10 surprising habits that may be causing your high blood pressure, so that you can make positive changes and reduce your risk. Now, before we begin, please take a moment to subscribe to our channel. If you find our videos helpful, please support us. Let's start with number 1, chronic stress. We all experience stress from time to time, but chronic or long-term stress can have a negative impact on our health, including our blood pressure. When you're stressed, your body releases hormones like cortisol and adrenaline, which can cause your blood vessels to constrict, leading to an increase in blood pressure. Prolonged periods of stress can keep your blood pressure elevated over time, raising the risk of heart disease and stroke. It's essential to find healthy ways to manage stress, such as yoga, meditation, or spending time in nature. These practices can help you relax and lower your blood pressure. 2, consuming too much salt. Salt is a common seasoning that adds flavor to our food, but consuming too much of it can have detrimental effects on our health, particularly on blood pressure. The American Heart Association recommends consuming less than 2,300 milligrams of sodium per day. However, the average person consumes much more than this, which can lead to an increased risk of high blood pressure. When you eat salty foods, your body retains water, which increases your blood volume. This can put extra pressure on your blood vessel walls, leading to high blood pressure. To reduce your salt intake, it's important to cook meals at home using fresh ingredients and avoid processed and canned foods, which are often high in sodium. You can also use herbs and spices instead of salt to add flavor to your meals. Number 3, lack of physical activity. Regular exercise is crucial for maintaining good health, and a lack of physical activity can contribute to high blood pressure. When you don't exercise regularly, your body becomes less efficient at delivering oxygen and nutrients to your organs, including your heart. This can cause your heart to work harder, leading to an increase in blood pressure. Additionally, exercise helps to improve your overall fitness level, which can reduce the risk of cardiovascular disease. Aim for at least 150 minutes of moderate intensity exercise per week to maintain healthy blood pressure levels. Number 4, consuming too much caffeine. Caffeine is a stimulant that's found in coffee, tea, soda, and certain medications. While moderate caffeine consumption can be safe, consuming too much of it can lead to an increase in blood pressure. When you drink caffeine, it stimulates your adrenal glands to release adrenaline, which can cause your heart to beat faster and your blood vessels to constrict. This can lead to a temporary increase in blood pressure. People who are sensitive to caffeine may experience more significant increases in blood pressure. So it's important to monitor your intake and avoid consuming large amounts of caffeine-containing beverages, especially if you have high blood pressure. Number 5, smoking and secondhand smoke. Smoking and secondhand smoke can significantly increase your risk of developing high blood pressure and other cardiovascular diseases. When you smoke, the nicotine in the cigarette causes your blood vessels to constrict, leading to an increase in blood pressure. Additionally, smoking damages the lining of your arteries, which can cause plaque buildup and reduce blood flow. Secondhand smoke can also have a negative impact on your blood pressure, even if you don't smoke. The American Heart Association recommends avoiding secondhand smoke to protect your cardiovascular health. 6, consuming sugary drinks. Sugary drinks such as soda and fruit juice can contribute to an increase in blood pressure. When you consume sugar, your body converts it into fat, which can lead to obesity and metabolic syndrome. Metabolic syndrome is a cluster of conditions that includes high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. All these factors can increase your risk of developing cardiovascular disease. To reduce your risk of high blood pressure, it's important to limit your intake of sugary drinks and opt for healthier alternatives such as water, unsweetened tea, or coffee. Number 7, consuming processed meats. Processed meats such as deli meat, hot dogs, and bacon can increase your risk of developing high blood pressure. These meats are high in sodium and saturated fat, which can contribute to an increase in blood pressure. Additionally, processed meats contain nitrates and nitrites, which are preservatives that have been linked to an increased risk of cardiovascular disease. To reduce your risk of high blood pressure, it's important to limit your intake of processed meats and opt for healthier protein sources such as poultry, fish, or beans. Number 8. Sleep apnea. Sleep apnea is a sleep disorder that causes your breathing to repeatedly stop and start during sleep. This can lead to poor sleep quality and a buildup of carbon dioxide in your bloodstream. The increased carbon dioxide levels can cause your blood vessels to constrict, leading to an increase in blood pressure. People who have sleep apnea are at a higher risk of developing cardiovascular disease and stroke. If you suspect you may have sleep apnea, it's important to seek medical attention and get a diagnosis. Number 9. High cholesterol. High cholesterol levels can contribute to the development of high blood pressure. When you have high cholesterol, it can lead to the buildup of plaque in your arteries, which can narrow your arteries and restrict blood flow. This can cause your heart to work harder to pump blood throughout your body, leading to an increase in blood pressure. Additionally, high cholesterol levels can cause inflammation in your blood vessels, which can also contribute to an increase in blood pressure. To reduce your risk of high blood pressure, it's important to maintain healthy cholesterol levels by eating a balanced diet and exercising regularly. Number 10. Age. As you age, your risk of developing high blood pressure increases. This is because, as you get older, your arteries become less elastic, which can restrict blood flow and cause your heart to work harder to pump blood throughout your body. Additionally, as you age, you may be more likely to develop other health conditions, such as diabetes or obesity, which can also contribute to an increase in blood pressure. It's important to monitor your blood pressure regularly and make lifestyle changes, such as eating a healthy diet and exercising, to maintain healthy blood pressure levels as you age. In conclusion, high blood pressure is a common condition that can be caused by a variety of factors, including chronic stress, a diet high in salt or processed foods, lack of physical activity, smoking, and age. By making positive lifestyle changes such as reducing your salt intake, exercising regularly, managing stress, and avoiding processed foods, you can reduce your risk of developing high blood pressure. If you have any concerns about your blood pressure, it's important to consult with a healthcare professional for personalized advice and treatment options. Thank you for watching and subscribing. See you in the next video.